Is that a snake in the patient's skull? That's not a snake, that's a feeding tube. How did a feeding tube end up in the brain? This is a nasogastric feeding tube. It is supposed to go into the nose, down the pharynx, and into the stomach. This feeding tube got into the brain through a part of the skull called the cribriform plate. The cribriform plate is located in the anterior skull base, and it's where the nerve responsible for smell exits the skull. So why does the feeding tube go into the brain? There are three usual reasons. 1. A fracture at the cribriform plate or anterior skull base is wide enough to let the tube in. 2. A thin cribriform plate. Chronic sinusitis and cocaine abuse can weaken the plate such that a feeding tube can puncture through it. 3. There can be a congenital defect the patient was born with that communicates between the nose and the skull cavity. A neurosurgeon will need to remove the feeding tube and control any bleeding. This is a rare but important complication to be aware of.